So tell us a little bit now that semaglutide and tirzepatide, as well as organic weight loss, have really risen to the surface for so many people. What kinds of surgeries after that type of weight loss do you see the most?
Yeah, that's a great question. It, not to sound like contrived about it, but it truly is like what bothers the patient the most. And that's the way our office is going to run. It's the way I want the practice to run. It's the way our staff will approach the practice is like, well, tell me what bothers you. And if they have a hard time kind of like pinpointing that, sometimes I'll say, just take one finger and point to what bothers you. So we can kind of like hone in on that, as opposed to me coming in and saying, you know what you need. I don't like that approach. That being said, there are trends that we see, and I think most patients would come in wanting to talk about their abdomen. I mean, that's where most patients' concerns lie. And then beyond that, I'd say half the patients I see have a secondary area of concern that they want to address. And that may be the breast, it may be the arms, it may be the buttock, it could be all kinds of different things, maybe some liposuction or something like that. But I would say for greater than 50% of patients, it kind of centers on the abdomen. And that dovetails pretty nicely with what we would see, honestly, in the non-weight loss patient too. Kind of your classic mommy makeover kind of thing, where if a patient's going to come into the plastic surgery office, a lot of that's driven by the abdomen or the breast. And those are kind of the things that make a mommy makeover what it is. So yes, the weight loss side of things creates some differences. They still have a lot in common with a non-weight loss patient.